Hey, this is Dr. Khan of the ACL Academy, and today I'm going to touch on the most important phase of the ACL recovery process. And by far, that is the first 2 months. Before I get further into the details, guys, if you've been watching my videos, please subscribe to the page, like the video, drop a comment, ask a question. We get to 99% of all of them. And you could also check us out on Instagram at ACL_Academy. So what I want to do is touch on the most important phase of the ACL recovery process, and that is the foundational phase. Those are the first 2 months. A lot of times people get this confused and they think, well, most important is getting back to sport and going through those specific sport-like movements, the cutting, the pivoting, the jumping, or whatever it requires to get back to your specific sport. And I will tell you, if you don't lay the foundation, you will absolutely fail in this process and not be happy with the end result. This is very similar, and not to sound too cliche, but building a house or a building. If the foundation's not set the right way, the rest of the building will just be garbage and collapse. This phase is so important. If you can lay down a few foundational goals, reach milestones, it will be setting up the remaining of the process to be super smooth, super successful. So what are those things that we are looking to nail down early on? Number one, swelling. You get rid of swelling in the knee as fast as possible. The reason being, swelling affects everything. It will affect pain levels. It will affect range of motion. It will affect quad activation. So getting your quad muscle awake and alive. You need to take care of that early. How do we take care of that early? Time off our feet is the end all be all. The more time standing, the more time walking, the more time you are stressing that knee joint, you're going to cause that knee to be a balloon. You need to get off your feet. Watch your step count. Number two, keeping compression and getting that leg elevated. So compression, you're going to send you home with an ACE wrap as soon as possible. When the sutures are out, you want to switch that over to a compression sleeve. That compression sleeve will just be easy to utilize. It's uniform compression, and I want you to work your tolerance up to keeping that on as much as possible. And of course, elevation. So elevate throughout the day, meaning get the leg all the way elevated above your heart, up against the wall, and let that fluid drain out at minimum 2 to 3 times a day. That's number one. Next is extension. Okay. The sooner we get that leg straight, the better it will be for you, meaning we can't walk with our knee slightly bent. We will be limping. The longer the extension goes without getting where it needs to be, the harder it is to get back. So we need to really nail that down as early as possible. How do we get extension back? That's a combination of two things. One is a lot of stretching. So stretching the back of the leg, the hamstring, the calf, the back of the knee joint, doing stretches for a long duration of time. So low load, long duration type stretching is going to be super, super effective. Then after we get those tissues nice and stretched out, we need to activate those quads. So we need to do a lot of in-range quad activation work. Squeeze those quads, work those quads, make sure that we are keeping that range. So that's how we work extension, and we want the extension to match the other side. So some people are going to say oh, flat is good enough. But no, if your other leg, your healthy leg, goes into what we call hyperextension, that means you need to match that side. Otherwise, I promise you, you will feel the difference when you're standing and walking. So swelling, extension, quad activation is number three, okay? That quad muscle will shut down after surgery. It will not want to fire up. You will lose volitional control, meaning like you'll try to squeeze your quad and something just won't feel right. That happens after a knee surgery. It's important to wake that guy back up. So we do what we call quad sets or quad contractions with the legs straight around the clock. I tell my clients 10 quad sets for every waking hour. You should be doing 160 to 180 or more quad sets per day. The more we activate that quad and contract it, the better it is to get that quad muscle awake. And once we can get it awake, that's when the true strength should start. So that is a big one. And of course, the last one is just getting that knee starting to bend. Okay, that's the last piece of the foundation. And we want to get some range of motion, knee bending early. I will tell you, it's not that we have to be so aggressive, but by the end of month one, I'd like you to between 100 and 120 degrees. By the end of month two, I want you basically full. These are the foundational milestones that we are looking to hit. And if you can hit these milestones, you will make the rest of the recovery that much smoother. By far, the most important phase of the recovery process is starting at day zero. What we're looking for, no swelling. We are looking for full extension, matching the other side. We're looking for get your quads awake and alive so we can start some true strengthening. And then we want your flexion at the end of month one to be over 100 degrees at the end of month two to basically be close to full, matching the other side. So I hope that is clear and makes sense. And now you understand the most important phase of the ACL recovery process. Guys, if you like this video, got value out of it, please subscribe to the channel. Most importantly, share it with your fellow ACLers. This is Dr. Khan here at the ACL Academy, and we are signing off.